So I've recently been having a lot of people come in with some toe pain and almost nerve-like symptoms happening at the toes. And I've been very successful with um, doing some release techniques up in the shin, especially where the peroneal nerve kind of splits and dives deeper to some of the muscles at the outside of the lower leg and kind of the front of the shin here. So I just want to go over a few techniques I love to do for this. So what you're going to see is I have an X drawn on the side of my leg here. If you kind of just rub, so it's going to be below your knee on the outside of your leg, you should feel a little bony prominence, and that is actually your fibular head, so the top of the fibula. And there are a few different muscles that attach there that we're going to hit first. So what I'm going to have you do, and you're going to use this technique throughout, so once you get the hang of it, you can kind of do this for all the muscles. But what you're going to do is you are just going to kind of push down right on that spot where that bone is. I want you to let your fingers kind of sink into that tissue, and then I want you to traction the skin. So what I mean by that is I'm letting my fingers sink, and then I can either traction down or even traction up, and you want to feel the skin actually slide as you pull up with your hands, okay? So we're not just pressing down and moving over the skin, we're pressing down, holding that tight, and then pulling up and dragging the skin, the fascia, and then hopefully a little bit of the muscle belly and kind of tendon up with you. Okay, so once you have that, so fingers sink, traction, you are going to go ahead and pull your foot up and turn it in. So just to show you again, I'm pulling my toes back towards my shin, and then I'm turning my foot in, okay, as I keep it pulled up. That's just going to stretch this muscle that we're trying to work here right at the outside of your leg, okay? So this should be directly on the outside of your lower shin. Okay, so once again, I'm letting my fingers sink. I'm tractioning so I can feel almost all the skin get pulled up, and then I'm pulling my foot back and turning in. Now, if you notice some tenderness there, I want you to kind of work through that area. You can even go down your leg a bit. But then where we want to go next is right next to this X, okay? So if you can find that bony prominence, now we're just going to go a little bit farther towards the front of your shin. And now we're on a different muscle group here. These are the muscles that are going to help lift the toes. And this is right where these nerves start to kind of dive deep to these muscles. So this area is going to be so important to hit. So once you're there, once you do the exact same thing, you're pushing down into the skin, just kind of let your fingers sink. You're not just compressing as hard as you can, just let your fingers relax into that tissue. And then I just want you to traction upwards. Now this time, we're just gonna be pointing the toes and kind of curling the toes under. And you're just gonna kind of do that through this whole area. Let your fingers sink, traction the skin upwards, point your toes, curl them down. And I want you to do that all through here. And you can go all the way down until you get to the bottom kind of the shin, okay? If you find areas that are a little tender, spend a little bit more time there. Or if you hit a spot that starts reproducing any of the symptoms you have at your toes, you're probably on something that needs it. So make sure you do just a little bit more there. I don't want you to spend a ton of time on this. Once you hit a spot, just do a few, maybe 5 to 6 reps over that area and then kind of move on, all right? So once again, this is probably the most important part. Let your fingers sink, traction the skin, and you can either traction down towards the foot or traction up towards your upper body, okay, whatever feels easiest for you, but make sure we're sinking in, tractioning, I'm literally pulling the skin with me, and then pointing the foot, okay, and you're gonna reset every single time. I don't want you to just hold on this spot, do this, and then just keep pointing the foot. Every time you're resetting, pressing down, tractioning, pointing, curling. Pressing down, tractioning, pointing, curling. All right? So go ahead, give that a try. It takes a little bit of practice, but it can make a huge difference if we can get this right. Also remember, the way you point your foot is important because what we're doing is kind of a pin and stretch method. So we want to make sure that we're pinning down the muscle and then stretching it in the right position. So if you're more on the front kind of corner of the shin here, it's always pointing the foot and curling. If you get more to this X, which is going to be right along the outside of your lower leg, then we're going to be pulling the toes back and turning in. Okay, so work your way through that. If you have any questions, please let me know.